Hey, welcome to another episode of Be Ready with Safety Man. My name's Corey Jones, safetyman.co. Remember, at Safety Man Security Consulting, we do three things, and those three things are designed to keep you safe. We do taser training and sales. Whether you're a private citizen, security, or law enforcement, we will come to you, or you can come to our training facility, and we'll train you how to legally, morally, and safely use a taser to defend yourself or take someone into custody. We also do active shooter readiness response training to any large group, to have businesses, schools, daycares, any place that you have a lot of people, hospitals. We'll do active shooter readiness response training so you can prevent, handle, and then recover from that sort of emergency. And finally, we'll custom design a specific alarm, security, camera, surveillance system for your structure. We're not going to take one that's out of a box and put it on you. We're going to take your situation, custom design it, so you can be safe. Safetyman.co for all your training needs. Now, I have a guest and a friend who I've known for many years that's with me today, is Jordan Barnett, MD, MBA. Jordan, if I were to give his resume, we would need 2 shows. And so I'm not going to do all that. I'm going to let him talk about some of the high points of his career. Jordan, what's up?
Oh, that was really generous. I appreciate it. So high points of my career. I guess let me talk about what I do right now.
Yeah.
So I'm an ER physician currently. I've been an ER physician for about 24 years at this point in time, currently with the Virtuous system. And I have a couple other hats I wear. I am the medical director of the Mount Laurel Township EMS, and my understanding is the Mount Laurel EMS system is the second largest in Burlington County. I wear a couple of other hats. I have a consulting company. The consulting company, it is emsconsultantgroup.com, and one of our most recent projects was we revised or helped guide the revision of Washoe County, Nevada's EMS system.
Okay.
2 other hats. I also am the medical director for a EMS training program in Philadelphia with the Department of Labor, which is Job Corps. Mm-hmm. And lastly, I was recently acquired by Allstate Career School to be their medical director for their EMT and paramedic program. So I keep myself kind of busy.
Yeah, that's a lot of hats. That's a lot of hats. All that has prepared you for this most recent mission, which I was tracking Dr. Barnett on social media, and it just grabbed my heart, this mission that he was involved in. And instead of me trying to tell you what this mission was, can you tell me what this most recent adventure was that you just went on?
And just to give credit where credit's due, I have a dear friend, her name's Rhoda Malivert. Mm-hmm. And she and I actually went to grad school together for our MBA, and that's how we became friends. She ended up reaching out to me regarding a medical mission to Haiti. Didn't look at the details too clearly. Hey, Jordan, would you come down to help out in the clinics in Haiti with Azure Medical College? My boyfriend's actively involved with that. Sure. Wait a minute, 2 weeks before, July, Haiti.
Oh.
Okay, I didn't exactly think this thing through, but
just so you know, July here was pretty rough too, heat-wise, but I'm sure.
Which will actually probably go into our topic later on about acclimation to different weather.
Yeah.
But so Jhonson Napoleon is the boyfriend of Rhoda Malivert, who's actively involved with trying to improve the social situation and the healthcare situation in Haiti. Mm-hmm. He is a self-made millionaire who has now dedicated his career, as I understand it, to improving the situation. And he's created this school, Azure College, which prepares nurses to end up entering the medical career. And a large portion of this is involved with a medical mission to Haiti to help out with the care being provided there. The medical system in Haiti is quite scary. I can go into this, and I'm sure we will.
Yeah.
But the goal was to go to the different medical centers with these nursing students and EMT students. We had 2 EMT students with us, and another ER physician, Prakriti Patel. And we went down to see what health care we could provide.
Okay.
It was quite an interesting experience.
Now, did you go to a specific part of Haiti, or were you like center targeted? Did there were special people waiting for you?
We actually ended up going to 3 different facilities located in different locations in Haiti.
Right.
Now, unfortunately, I don't speak any Creole, and my French is limited to that of Miss Piggy.
Yeah.
So
okay.
I have the names. I printed them out for you. I'm not even going to attempt to bastardize saying them.
Yeah.
But Haiti was devastated by an earthquake years ago, and they've never fully recovered. Combine that with the fact they have a social economic system which is in disrepair. They don't have a tax base. The people are extremely poor. They have a healthcare system that's based on pay first for service, all of which, with the lack of resources after the earthquake, has left the people of Haiti in a desperate plight. To give you an example, I ended up going into one of the hospitals with the nursing students. No sheets on the bed. The families have to bring their own sheets.
Wow, wow.
We had a trauma victim who ended up with multiple lacerations on his head. I couldn't start any care because the family had to go to this walled-off pharmacy to prepay for the suture material.
Wow.
They brought me the wrong suture material because that's the only thing they could afford. Example number one. Example number two, there was a small child who had been hit by a motorcycle a day or so prior.
Wow.
Child was left in dad's lap, no sheets on the bed, crying in pain for 2 days. The family couldn't afford the medications to even treat the pain. And we actually got chastised to a degree for what we ended up doing, but the nurses and I reached into our own pockets to pull out money to get the child at least some pain medication.
Right. Well,
So
thank you
hope,
for that.
Yeah, I hope these examples help bring to light how desperate the care situation actually is in Haiti and why there was this motivation by Jhonson Napoleon from Missouri College to try to get me and other medical professionals to come down to help and also bring awareness to what's going on down there.
So you said that part of it was due to an earthquake, and that earthquake was several years ago.
Absolutely.
Right? And you know, it's in social media, it's on the news, and so forth. People kind of forget. But I think what the viewers need to understand is this is still an ongoing need down there.
Yes. So we are very, very fortunate here in the United States. Between laws that were passed and the fact that care is provided first and costs being considered secondary has created its own problems. I mean, we've got issues of people ending up with bills that they can't afford, bankruptcies, but down there, with no tax bases and the people being so poor, there are no funds to help provide the equipment and the resources that hospitals need to function.
Right.
And after the giant media blitz and international help, all of a sudden there was this vacuum. Everybody left. But meanwhile, the resources that these local facilities had were exhausted,
Right.
leaving a group of individuals who don't even have the money to help rebuild their own healthcare system.
Wow. Wow. So, what exactly did you do? You went down with this school. You went down with these nurses. You visited a few sites. Were you hands-on? Were you kind of back off and trying to direct things?
Well, if you don't mind me quoting Star Trek,
Please.
I was trying not to violate Prime Directive, although I did that on a couple occasions. We ended up going to a bunch of different locations. I was hands-on. We were involved with trauma care. We were involved with care of folks who were septic. At the same time, I was trying to be respectful of the fact that I had these Haitian interns and could not, and residents, and couldn't say, well, this is how we do it in the United States.
Right.
Because that's also insulting. You know, here's this foreigner coming in telling us how we should do things.
Right.
Additionally, full respect to the Haitians. As an American physician, how spoiled am I? I'm not sure what's going on with your belly. You know what? Let's get a CAT scan. Let's see what's going on with all the organs. You know what? You're having chest pain. You know what? I don't want you to actually go down to the radiology suite. Let's go get the portable X-ray machine here. Put a plate behind you, and digitally, I can see what's going on in your chest in a matter of seconds.
Wow. Okay.
The Haitian physicians down there, I have to give them giant kudos. Their hands-on diagnostic skills have to be so much better than mine and other American physicians because there is no ability to be so reliant on technology.
Okay.
So yes, I was involved with guiding and taking care of trauma patients, but at the same time, I was trying to help teach and guide because how disrespectful would it be otherwise?
Right. So you had to do that kind of gently in both aspects.
Right.
Yes.
And I guess to complete your question, I also was dependent on them. I don't speak French or Creole. So the nursing students that were accompanying us from Missouri College, those that were bilingual, were absolutely instrumental. In fact, the first day there, it was almost sadly a comedy show. I speak Spanish.
Right.
One of the residents from the college down there from Haiti apparently studied in Cuba, so he was speaking to me in his broken Creole Spanish, and I was responding in my broken English Spanish, and somehow or other we managed to communicate. So,
wow.
Yeah.
Well, they just communicated to me that we got to take a commercial.
Absolutely.
So that
Okay.
first 15 minutes, we have so much more. Please come back after this commercial break. Please come back. There's just so much more we want to hear from Jordan. All right, we'll be back in a minute.
TV is a platform for people of any industry to share their story. Over 285,000 viewers are tuning in to RVN TV shows monthly. We guarantee a great experience that you'll be sharing with everyone you know while increasing your personal and company's brand awareness. But what is your brand? According to Forbes, it's a combination of your logo, your product, your design and feel, and your personality. Did you know that aside from being a guest, we offer even more opportunity to boost your brand? Adding your company logo and website on screen during your interview will allow viewers to recognize your brand instantly. Incorporating images and video clips is another great way to showcase your product during your live segment. Let viewers see how good you really are. And most importantly, there's you and your interview. For less than the cost of a newspaper, direct mail, or a magazine ad, you can leave our studio and within 48 hours have a permanent digital copy of your live segment to link to your social media, embed into your company website, or use in email marketing. Investing in your brand is so very important, and we can't wait to have you as a guest.
Shelter dogs aren't broken. They've simply experienced more life. If they were human, we would call them wise. They would be the ones with tales to tell and stories to write, the ones dealt a bad hand who responded with courage. Do not pity a shelter dog. Adopt one.
Say we've got grit, and we'll take it as a compliment. Because it's our uncommon drive, our spark within, that brings us together and sets us apart. We are temple made. And when others take shortcuts, when others take breaks, when others take the easy way, we take charge.
All right, we're back. That was a fantastic set of commercials. Said no one ever. All right, Doc, thanks for hanging out with me.
No worries.
We were talking about Jhonson Napoleon, who kind of helped mastermind or put this together. Can you tell our viewers who Jhonson Napoleon is?
Absolutely. First of all, I'm so impressed and awed by him. So here is a gentleman who's Haitian born. My understanding is at the age of 19, left the United States, has become a self-made millionaire. And even though he carries a US passport, is absolutely emphatic about his home country of Haiti and improving the situation there. And he's big in social media. Even the patients that I have here who are American-born Haitians or Haitian descent. I had a young boy recently who ended up coming into the ER with an arm injury. Put his arm through a window, and we started talking. And I mentioned his name, and his eyes opened up. He's tremendous in social media down there, is actively involved with providing clean water. He's building a water plant down there. He brings nursing students down there. He's planning, after our conversations, even discussing with me the possibility of improving the EMS system down there, which is actually my forte, so I'm hoping this comes to fruition. So this is an incredible man who's dedicated his life to improving his home country after leaving, coming to the States, and the very fact that looking at the resources there versus the resources here, that he stated to himself, listen, this is my birthplace.
Right.
I care about this country.
Of course.
I'm going to go back and do what I can to improve the lot of my fellow Haitians. Speaks to me so highly of who this man is.
Of course. And that's Jhonson Napoleon, Jhonson, Jhonson _ Napoleon, like Napoleon Dynamite. And you'll be able to find Jhonson Napoleon on Instagram and also Jhonson, Jhonson at Azure, azure.edu, so you can help. If I don't say it now, I'll definitely forget.
And Azure is his nursing college.
So I think we have some pictures that doctor's going to walk us through. There we go.
All right, so this was actually, I'm going to get killed for this. The woman on the far left of the screen is one of the physicians who went down with me as a friend.
Okay.
And the work and the heat was so exhausting. What you're seeing is two of the nursing students on the right, but also Dr. Patel, who probably after this picture being on TV, I'm going to end up being in the doghouse for a while.
So it was hot, but you guys were still able to make fun and take off some of the steam and some of the pressure of the seriousness of the situation?
We ended up bonding because I didn't know any of these nursing students.
Right.
Dr. Patel came down with her two daughters, who are EMTs, to also help out. So was pressure let off? Absolutely.
Good.
We had meals together. We had conversations together. Was it hot? Absolutely. It's Haiti in July.
So it's going to be hot.
We're spoiled. We have air conditioning wherever we go.
Yeah.
A lot of the medical clinics didn't even have working fans.
Wow.
I remember having to sew up a trauma patient, and the sweat was pouring off me so much that I ended up with it pouring into my eyes, and here I'm trying to suture with the sting of the sweat entering my eyes. It was rough. And that's also the reason why, while Dr. Patel may be very, very upset with me that ended up there, it does also speak to the fact that we worked hard and they fell asleep. They were exhausted.
Cool. Let's go to the next picture.
Okay. Okay. So the medical center I told you with the trauma patients,
Right.
where there was no working fan, there is a fan up there in the corner. It doesn't move at all. There are small little slit windows, but there's no air circulation.
Wow.
If you take a look, there are absolutely no sheets on the bed. If the families don't bring sheets, there are no sheets. You would lay on that mattress with the blood or the body fluids just laying there.
Wow.
Again, we are spoiled. What do you mean I don't have a private room in the emergency department? What do you mean there's a curtain between us? I believe there was at least 6 or 7 beds in that room alone. So it just shows the difference between what we have here as Americans that we've gotten used to versus the situation that they have in one of the hospitals.
And that's what you had to work with. Next picture.
Okay. This was actually the interns and residents that I ended up giving a lecture to that was invited to the hotel that we were staying at. And I gotta tell you, this is the first time I ever gave a lecture where everything had to be translated as I'm saying it into Creole or French.
Wow.
But these doctors, as I had shared in our first segment, were absolutely amazing. Their clinical skills, their diagnostic skills using their hands are amazing. We learn from each other. I'm very, very humbled by who these people are.
All right. Well, thanks for putting those pictures up. I wanted to get our viewers to understand some of the obstacles you had to do, because this isn't just like jumping in a minivan and going to Baltimore. There's a little more involved in this. Were there any safety or any obstacles you had to?
So first of all, the State Department put Haiti on a level 4 warning. And Jhonson Napoleon was aware of that. We actually had to be escorted by police to our first 2 locations. Unfortunately, the pictures aren't here, but at the airport, the police carry shotguns. I don't know one weapon from the other. You're the expert on that. You saw some of the pictures. But it was quite intimidating, these long, but looked to me as a military weapon.
Yeah, no, they were definitely military weapons that they had at the airport.
And they're wearing the helmets that I would expect to see soldiers in a field being wearing. They're wearing what looked like body armor.
Yeah.
Additionally, the other obstacles that we ended up contending with as we were traveling out is horrific road conditions. There's no way that I can see for an effective EMS system out there because the roads, if you think potholes in New Jersey are bad, you have absolutely no idea.
I can imagine.
There's no traffic lights for the most part. Additionally, what ended up happening was we ended up having to be evacuated early. There was a riot that ended up occurring. They closed down streets. We ended up taking refuge. Again, I keep speaking of him so highly, but he managed, as we were blocked off from proceeding to Port-au-Prince during the evacuation, finding a minister that he was familiar with who put 25, 30 strangers up in his home.
Wow.
Pending the streets being open enough to safely get onto the roads to our next destination away from danger.
Away from danger.
Away from danger, because the roads were blocked down. There were tire burnings. The exact circumstances behind this, I don't know, because again, my language is limited.
Right. But it's unstable down there as it is.
Absolutely.
Absolutely unstable. So this need is definitely current and ongoing, you see?
Current and ongoing. The safety, my understanding is there's a limited police presence and limited amount of legal recourse from a government standpoint to handle what we, again, are spoiled with Americans.
Yeah. So speaking of Americans, how would you take, I also want to talk to my guests about how they can use this information and your experience to protect themselves here while they're in America. Like, what are some basic personal medical protection things that we can do here?
In terms of foreign travel?
Yes, yes.
Okay, so we're talking about the American traveling abroad.
Yes.
Gotcha. Well, part of this was also a learning experience for me. And we were joking before we actually started this about a doctor who treats himself as a patient has a poor physician.
Yes.
So, not being cavalier, I am an emergency medicine physician. I am not an infectious disease or a travel medicine doc. I ended up looking online for travel medicine clinics. So one of the first things that I would recommend for pretty much anybody who's traveling abroad is either go seek out one of these travel medicine clinics. A lot of the universities have travel medicine offices as well. I would absolutely seek them out.
Right.
And if you're going to someplace more stable, at least have a conversation with your primary care doctor. And when I say more stable, I'm talking more along levels of healthcare like ours in the United States.
Okay.
So if I was going to France or to England or to Germany, I'd probably not be as cautious, but certainly be going to South America or regions like that. There's Zika. If you're pregnant, there are issues such as malaria, there's typhus. You don't want to be traveling without seeking that care. Additionally, what these clinics can also do for you is they'll actually give you checklists for things that you might otherwise forget.
Right.
I would not have had the forethought to get permethrin to spray all my clothing before going down there to help repel mosquitoes. I would not have thought of that. So those are two things. The other thing is registering with the State Department.
Okay.
So if you're traveling to a place which can potentially be unstable, having that resource and having the backing that if something was to go wrong, that the U.S. government is aware that you might need help, I think is paramount.
So letting them know that you're there already, so
Absolutely.
you're not a surprise.
Right. You could register with the State Department of Foreign Travel. Also, yes, I ignored the State Department warnings about the level that Haiti was at the time.
Right.
But to plan your trip accordingly, to take heed of the fact that certain areas of the world are unstable and are probably not the best places to go as Americans.
Right. Right.
Again, was I cavalier? I was presuming that just like in old war movies, the person with the cross on their sleeves representing a medic would not get shot.
Right.
It was cavalier. I did not get injured, but it just shows, I guess, my attitude, which I'm glad I did.
It shows your dedication to the mission is what it definitely shows. I mean,
Thank you.
You know, you and I both put ourselves, in our careers, you put yourself in harm's way. In EMS, you put yourself in harm's way dealing with potentially unknown medical conditions, and now you put yourself in harm's way to go in a foreign country and render medical aid to people who are clearly in need and don't have the means to do it themselves. And, you know, I thank you for that. I know our viewers thank you for that. And I'm just going to try and get as much information out of you as I can because I'm Be Ready with Safety Man, and I want my viewers, I want you, I want all of our friends to be able to be ready if something happens. Now, you were talking specifically about climate acclimation.
Yeah.
That became an issue.
Absolutely. So we were traveling with a pastor who, in conversation with her, she is Canadian, of English descent. So we have a very fair-skinned woman who's from northern climes, who's now again in Haiti in July, which was, I think the times I used to use the laundromat on South Street in Philadelphia during the summer might come close. She ended up with heat exhaustion. She was an elderly woman, ended up becoming nauseous between the heat, the road trip. She was getting sick.
Right.
And acclimation is not just for heat, it's for lots of travel. You know, if you were to decide tomorrow, you know what, I'm going to climb Mount Everest, go to Nepal to do so,
Yes.
you're married to a personal trainer.
Right.
You're physically fit. To presume that without getting some medical help or time to acclimate, that you can summit Everest without ending up with pulmonary edema or high altitude sickness
Yes.
is cavalier, which again, I'm reinforcing the importance of getting pre-travel health care, either from a travel clinic or at least from your primary care doc.
And health insurance you were talking about too, right?
Oh yeah, actually that's extremely important. So there's a couple of things that are available. I haven't scuba dived in years, but I still hold on to my Divers Alert Network insurance. It covers medevacs in case of illness. It's not expensive. It's a resource, whether or not you're a diver or not, that many people can end up taking advantage of. There are large corporations that end up using companies, one of which I've been trying for years to get a job with. One is International SOS,
Okay.
and the other one's Assist America, but there are multiple companies like this. And they provide coverage for universities when their students go overseas to help cover medical emergencies and evac if necessary.
So real quick, I know we got to wrap up. I want our guests to remember these couple of things. Talk to your primary care physician, look at the State Department and find out everything you can about the country or area you're going to. Look into getting some medication for pre-supplying and look into getting travel insurance. And if you want to help out, like I said, this need is ongoing, is Jhonson, Jhonson at azure.edu, or you can find him on Instagram, Jhonson_Napoleon, who you'll find him on Instagram. You'll be able to reach out, see the need for yourself, and help out. Again, doctor, thank you so much.
Always a pleasure.
Thank you so much for what
Thanks.
you did and what you continue to do.
Thank you.
Come back next week. Be ready with Safety Man.